Hey there. So, what do you know about mucus and phlegm? Yep, I'm talking about mucus and phlegm here. All that white, yellowish, green, or brown stuff that you either cough up or sneeze out. They actually have such an important role in our health. Mucus is like the air filter we're all familiar with. It removes allergens and pathogens floating around in the air. The same one that we have to change out or wash out every so often in order to maintain its effectiveness. Well, the mucus in our airways trap the viruses and the bacteria that we inhale. In there, two things can happen. Either these pathogens are inactivated by our immune system while they're still within the mucus, or the pathogens somehow escape and gain the ability to break through and enter our healthy tissues. All the while, our immune system is trying hard to stop this infection. Just like in all battles raged, there's bound to be collateral damage. Our healthy tissues, whether in the sinuses, in the throat, or in the lungs, for example, when they are damaged by the viruses or the bacteria, the ruins, so to speak, have to go somewhere, right? Well, in our airways, this is often in the form of yellowish, brown, green, or white phlegm. This phlegm, all this gunk, contains active and dead bacteria, contains active and inactive viruses, plus different components of our immune system, plus all the dead tissues created by the invasion of these pathogens. Common sense alone tells us that the sooner you can get this phlegm out of your body, the faster you will heal, and the more effective your immune system can remain. This is one of those situations where common sense does have validity to support it. I remember when I was learning Chinese medicine from my father, he mentioned that he always noticed in his patients that the ones who could expectorate, hawk up, or actively spit out that phlegm are always the ones that heal faster from their respiratory infections. They get over their colds and their flus faster. In my clinical practice, I observed the exact same phenomenon. Those who couldn't or don't know how to cough up the phlegm have the gunk trapped in their system, and it takes a lot longer for their lungs and airways to dissolve it. Or if you happen to only know how to swallow phlegm, your digestive system would bear part of that burden. Either way, it's definitely not as ideal compared to being able to actively spit out that phlegm. So remember, if you catch a cold or the flu, make sure to try your best to actively spit out that phlegm so you can heal a lot faster. Understand that phlegm left in your airways lead to wheezing, reactive airways, asthma, or problems with chronic cough. One thing to also note is that the phlegm caused by COVID 19, when compared to other types of pathogens, are often described by patients as being gel like in consistency, making it stickier to the airways and also more difficult to spit out. I personally think this is one of the key reasons why many more people suffer from chronic breathing issues after a COVID 19 infection.